Surgery casualty is incomplete without a case of acute abdomen. Thus, weighing in the importance of the same, here are the basics of abdomen. Though not seen, dermatomes and Langer's lines are very important with respect to the abdomen. The highlights are T4 corresponding to the level of nipples and T10 corresponding to that of the umbilicus. Langer's line should be in mind while putting an incision as it determines the tension during apposition of edges. Coming to the most frequently asked question, the layers of abdomen. Superficial to deep, they are skin, subcutaneous tissue, superficial fascia divided into the fatty layer, campus fascia, and membranous layer, scarpa's fascia. Then comes the muscle layer, external oblique, internal oblique, and transversus abdominis. Deep to it is the transversalis fascia, extraperitoneal fat, and finally the parietal peritoneum. The order of the muscles and the direction of muscle fibers are very important. The direction of muscle fibers commands the manner in which the muscles are split during surgery. External oblique goes downwards and forwards as hands into the pocket. Internal oblique goes upwards and forwards as hands on the chest. Transversus abdominis fibers go straight forward. All three end in the linea alba in the midline. Now that the basic structural concept is clear, the important incisions used are discussed next. Abdominal incisions can be vertical, transverse, or oblique. Vertical incision. Midline incision sparing the umbilical cicatrix is primarily used for diagnostic laparotomy. It divides the linea alba and thus creates a bloodless field, but it causes more morbidity. Upper or lower midline incisions can also be used based on the site of exploration. Upper incision can injure the falciform ligament and lower incision can injure the bladder while opening the peritoneum. Therefore, for both the incisions, peritoneal puncture should be in proximity to the umbilicus. Paramedian incision also provides bloodless plane, and the method used is muscle splitting rather than muscle cutting, thus less morbid. It is used mainly for access to the liver, spleen, or stomach. Oblique and transverse incisions. The right subcostal or coccus abdominal incision is used for open cholecystectomy. Modifications are chevron's incision used for total gastrectomy, esophagectomy, hepatic resection, and bilateral adrenalectomy. Another modification is the Mercedes-Benz incision used in liver transplant. Transverse incision is used in infants for better access to the abdomen. Rutherford-Morrison incision is a muscle-cutting incision used to gain access to the right-left colon, retroperitoneum, or the major vessels. Maillard and Pfannenstiel incisions are used in obstetrics and gynecology. Turner-Warwick is used in neurosurgery. Coming to the incisions used for appendectomy. These incisions are placed on the McBurney's point, which is at the junction of the middle and lateral one-third of the line joining the umbilicus and anterior superior iliac spine. McBurney's or gridiron incision is put obliquely as shown, and it can also be extended laterally. When extended laterally, it is called Rocky Davis incision. The most common incision used now is the Lamb's incision, also known as modified McBurney's incision. It is transverse and can be masked by a skin crease. It has better cosmetic appeal. Thus, I conclude this video. Happy learning.